Schizophrenia, as defined by the DSM-5, is a psychotic disorder characterized by disturbances in thinking, emotional responsiveness, and behavior. It states that symptoms such as delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, negative symptoms such as diminished emotional expression must be present in order for a patient to receive a diagnosis of schizophrenia. Other symptoms of schizophrenia include inappropriate effects, a disturbed sleep pattern, dysphoric mood, anxiety and phobias, cognitive deficits, as well as depersonalization and derealization. Individuals with schizophrenia are often treated with antipsychotic medication, individual therapy, CBT, CET, rehabilitation, and in more extreme and treatment-resistant cases, hospitalization and electroconvulsive therapy may be used. Currently, schizophrenia affects around 20 million people worldwide, with the annual number of new cases of schizophrenia being 1.5 per 10,000 people. Schizophrenia is one of the top 15 leading causes of disability worldwide, and approximately 5% of people with schizophrenia die by suicide, while about 20% of people with schizophrenia attempt suicide at least once in their lives. This graph shows the prevalence of schizophrenia by age, where it was found that schizophrenia was most prevalent in people between the ages of 30 and 50 years old. In America, the lifetime prevalence of self-reported psychotic symptoms is highest in Black, Latino, and White Americans and is the lowest in Asian Americans. And research has found that Black Americans are 3 to 4 times more likely than White Americans to receive a schizophrenia diagnosis. The first systematic examination of schizophrenia subtypes found that catatonic subtype was rare in the West, hebephrenic subtype was common in Japan, and simple subtype was common in Asia. In general, paranoid schizophrenia was found to be the most common subtype, with the hebephrenic and catatonic subtypes being more commonly found in developing countries. Studies also found that religious delusions are common in Christian societies but are more rare in Hindu, Muslim, or Buddhist societies, and magical religious delusions have been found to be greater in rural societies. Religious grandiosity and visual hallucinations are more common in African countries. There is a higher occurrence of auditory and visual hallucinations in non-European patients than in European patients, as Western societies tend to view schizophrenia symptoms as a medical issue, while Eastern societies treat it as a spiritual or supernatural phenomenon. This map shows the prevalence of schizophrenia by country, with the US, Australia, and Greenland having the highest rates. Here, Africa is shown to have a lower rate of schizophrenia, and while this may be due to a lack of studies done regarding mental illness in Africa, it may also be due to the cultural differences in how psychotic disorders are viewed in rural African societies. Schizophrenia and its symptoms can manifest in different ways in different cultures, and one example of this is the Xhosa people of South Africa. In Xhosa culture, it is believed that mental illness is caused by witchcraft or bewitchment, and paranoid delusions and hallucinations are often triggered by an intense fear of magical persecution and bewitchment. Because of this, persecutory delusions appear to be the most frequently reported type of delusion in Xhosa people with schizophrenia. Other reported symptoms include the belief that others are talking about them, receiving special messages from outside sources, grandiose and somatic or physical delusions, delusions of thought control, and thought broadcasting. The impact of bewitchment may then manifest in social misfortunes such as unemployment, family conflict, and a loss of social support within the community. Traditional healing interventions are sought to repel bewitchment and protect against further attack, including rituals aimed at cleansing the patient and their family of evil spirits. However, some of these hallucinations, like hearing voices of ancestors, are revered, and those who have these hallucinations may be apprenticed to become traditional healers, as seen in this photograph of a witch doctor initiation ritual. When looking at how schizophrenia manifests in individuals across various cultures, we can see that themes of delusions are often related to patients' social background, cultural beliefs, and expectations. In Vietnam, for example, patients with schizophrenia are often reported to have delusions of ancestors haunting them for a family's past shame, or visual hallucinations of the Buddha, as Vietnamese culture has many factors rooted in Buddhist and Confucian traditions, with the role of family, ancestor veneration, and traditional healing also being important aspects of Vietnamese culture. As for treatment, families of the patients often bring them to pagodas for traditional healing before seeking psychiatric or medical assistance, where these spiritual healers may tell schizophrenic patients that they're being haunted by the devil or demons, or that there's a spirit following them, and by legitimizing the presence of spirits instead of recognizing the hallucinations and delusions as a psychiatric problem, the symptoms of delusions and hallucinations may be exacerbated. Traditional healing treatments may include alternative treatments such as the use of herbal medicine or acupuncture. Stigma is defined as the negative beliefs, attitudes, and behaviors directed towards people based on some distinguishing characteristics, and in the cases of mental health stigma, it involves the negative perception or stereotypes based on the presence of mental illness symptoms or diagnosis. Schizophrenia is one of the most stigmatized mental illnesses, as it is commonly misunderstood and misrepresented in the media. One of the most common stigmas is the belief that schizophrenic people are inherently violent or dangerous. This stereotype is perpetuated by media portrayals and can lead to fear and discrimination against those with the disorder. One study found after analyzing over 40 movies that depict schizophrenia that most of the characters displayed positive symptoms of schizophrenia, with delusions being featured the most frequently, followed by auditory and visual hallucinations. They also found that the majority of characters displayed violent behavior towards themselves or others, and nearly one-third of violent characters engaged in homicidal behavior. Other stigmas and stereotypes include the belief that people with schizophrenia are unable to function in society or hold down jobs, which can lead to an underestimation of their capabilities and exclusion from opportunities for employment and social participation. There's also a tendency for people to blame individuals with schizophrenia for their condition, assuming it's a result of personal weakness or moral failing, rather than recognizing it as a complex medical condition influenced by genetic, environmental, and neurobiological factors. Stigmas and stereotypes can be incredibly damaging and have many harmful effects on those struggling with mental illness. Stigmatizing attitudes can lead to a sense of hopelessness for individuals with schizophrenia, making it harder for them to seek help or adhere to treatment plans due to fear of judgment or rejection by society. Some of the effects of stigmas against schizophrenia include social isolation, where individuals with schizophrenia may withdraw from social interactions due to fear of judgment or rejection, which can exacerbate feelings of loneliness and depression. Stigma can also lead to discrimination in the workplace, with individuals facing challenges in obtaining and maintaining employment. This can contribute to financial instability and a sense of purposelessness. Stigma surrounding schizophrenia may discourage individuals from seeking help or adhering to treatment plans. Fear of being labeled as crazy or dangerous can prevent individuals from accessing necessary mental health services, leading to untreated symptoms and a worsening of the condition. Constant exposure to stigmatizing beliefs can also erode self-esteem and self-worth in individuals with schizophrenia. Internalizing negative stereotypes may lead to feelings of shame and inadequacy, further hindering their ability to engage in meaningful activities and relationships. Stigmas surrounding schizophrenia and mental illness in general are deeply rooted in society. However, there are steps that can be taken on not only a personal level, but also on a larger scale to create a more supportive and understanding society for individuals living with schizophrenia. The first step to reversing stigma is having compassion and understanding for those who are struggling, as well as using respectful language when discussing schizophrenia and avoiding stigmatizing terms and labels that perpetuate negative stereotypes. Education and awareness are incredibly important for reducing stigma, as promoting accurate information about schizophrenia through educational campaigns in schools, workplaces, and communities provides opportunities for open discussions and dispelling myths and misconceptions about schizophrenia. Other ways to reduce stigma include advocating for laws and policies that protect the rights and dignities of individuals with schizophrenia, as well as encouraging responsible and accurate portrayals of schizophrenia in the media and not taking depictions of mental illness in movies and TV at face value. Creating a more easily accessible support service for people with schizophrenia and providing them resources will also help reduce stigma and promote recovery.